Inflammatory excess visceral fat is one of the most dangerous things that you can have in your body. It's a setup for type 2 diabetes. It's a setup for many different kinds of cancer, for heart disease, and even dementia. I was astounded to see that drinkers had a shrinking of their waist circumference, and they had less body fat, and their inflammatory markers also went down, and they actually lost weight. They gave half of the group 4 cups of coffee every day for 6 months. The end of the study, drinkers lost 6 pounds. The placebo group gained 4 pounds. So step number 1, if you want to lose visceral fat, do not. If you really want to fight body fat and raise your metabolism, you don't want to fear your food. You want to actually lean into it, to look for delicious, healthy foods eaten at a modest volume, and also eaten at the right time, So it's not just, it's obviously what you eat is important, and how you eat is important, but when you eat can also make a difference. It turns out that yes, oily fish are healthy because you get marine omega-3 fatty acids, but there was a study from Iceland that was quite surprising. They wanted to look at what the effect of omega-3 fatty acids were on body fat. And guess what? Turns on brown fat, shrink, helps you lose weight, burns away visceral fat, so your waist size can shrink. And of course, they found it that eating salmon 3 times a week for 8 weeks will actually cause you to lose up to 15 pounds. All right, so that's a lot of weight. Omega-3s are in salmon, right? It's a oily fish. In fact, I can tell you there's 565 milligrams of omega-3, marine omega-3, fatty acids in a 5 oz serving of salmon. Okay, but here's what's crazy, and I think this is what opened my eye. The same researchers studied what they thought was going to be a non-oily fish like cod. Cod's not considered an oily fish. Cod only has 284 milligrams, not 500 of omega-3 fatty acids. Pretty low. Guess what they found? People that ate cod 3 times a week lost 10 pounds over 8 weeks. Wow, you don't have to eat mackerel and anchovies in order to get adequate omega-3s when it comes to your metabolism to fight fat. Something as low as cod with that amount of omega-3s will do it. So, in my chapter, I convert in different seafoods that cod amount of omega-3s. You want 284 milligrams of omega-3s in a serving. Guess what that translates to into medium-sized Gulf shrimp? Oh, you only need eat 4 Gulf shrimp to get as much you get in that serving of cod. How many oysters? You need to eat oysters. You want mackerel, which is really oily. You only need 1 forkful of mackerel to get that amount as a cod. You don't even need that much mackerel. Halibut, which is, a very mild white fish, right? Not oily. You only need to have eat half a piece of halibut half the size of a deck of cards in order to get the same amount of omega-3s as you get in cards. Remember, I told you when you actually eat food, your insulin rises in order to draw that energy to load into your cells. Our metabolism is hardwired so that when you're eating with and your insulin's going up, our metabolism stays focused on loading up on fuel, not burning it. Okay, when we're not eating, our insulin goes down. Our metabolism switches gears like switching train tracks and basically says, all right, it's time to burn some of that fat stored in cells. And maybe you're burning the fat from dinner. Maybe you're burning the fat from yesterday. Maybe you're burning the fat from the holidays, but that's actually when you're sleeping. You're actually able to burn. That's the way our metabolism is hardwired. So, here's what I do. I try to give my body as much time to naturally burn a fat as possible. If I'm sleeping 8 hours a day from 11:00 to 7:00, for example, all right, here's what I do. When I eat dinner the night before, if I eat dinner at 7:00 and I put the dishes away at 8:00, I don't eat anything after dinner. Now, guess what? I put the dishes away at 8 o'clock. I go to bed at 11. I've gained 3 extra hours of fat burning, metabolism, grooming. I'll wait an extra hour before I eat breakfast. Okay, now I've gained an extra hour. So the 8 hours of sleep plus the 3 hours of night before, 11 hours plus 1 extra hour in the morning, I have just spent half my day burning down extra fuel. All right, so what are some foods that you can eat that actually make you feel full? And how do you eat them so you can kind of get to that better desired state? Well, first of all, foods that have a lot of dietary fiber like chickpeas, legumes, lentils, white beans. I mean, you ever have like a bean taco? All right, like one bean taco will make you eat less dinner later on, right? For lunch, for it'll make you eat less dinner later on. And that's because beans with all that dietary fiber actually have a satiety effect. Not only on your gut, but also in your brain, and that's a good thing. And that dietary fiber, by the way, has a fringe benefit, a big one, which is that dietary fiber feeds our gut microbiome. And that gut microbiome turns out to be much more important than we thought for longevity. Okay. And this is an area that I'm super fascinated by because here we are talking about gut health and anti-inflammation and autoimmune diseases and all of the current discussion around gut health. All right, turns out the latest research shows that this is as important in ways that we haven't fully figured out yet for longevity. And this was a study done by Cornell in New York, looking at Swedish women who were normal body size or skinny. So you've heard of skinny fat. This is what they were studying, and they looked at these women to see they did DEXA scans, as you described to see how much body fat they had. And then they followed them over 13 years, and they actually found that women who did not have extra body fat had, normal risk of breast cancer. But women who had skinny fat, so remember all the women in the study, and so 0 women actually were normal body size. I mean they weren't supermodels, but they were just normal-sized women. Some of them were slimmer than others, but none of them were obese. None of them were overweight, just normal size. But they knew at the B baseline what the DEXA scan showed, and what they found is that women who had excess body fat over the period of 13 years had a 3-fold increase in the risk of developing breast cancer, and it's linked to higher inflammatory markers in their bloodstream. Which makes total sense. The leaking body cream, the leaking inflammation, in a skinny tube, all right, or normal size tube, normal suitcase. Look, the suitcase can't expand bigger. It's got a finite size, but it's leaking out. And this is because cancer thrives in an inflammatory environment. If you have inflammation without even a microscopic cancer like we talked about, but a small tumor. Putting inflammation in the environment of a cancer is like pouring gasoline on the embers of a fire. You ever go camping, you have a campfire, it's almost out at the very end. Now, if you pour some gasoline, it boom whoosh. You're going to have to create a bonfire all over again. That's how dangerous inflammation is. So that's why excess visceral fat, inflammatory fat, is so dangerous and linked to cancer. And by the way, not just breast cancer. Turns out that excess visceral fat has been linked to 14 other cancers, increased risk of 14 other cancers, everything from colon, ovarian, lung, breast, prostate. It's a growing list of cancers that seem to be you would be at higher risk if you had actually high levels of visceral fat, and it makes total sense given the inflammation. Now, inflammatory excess visceral fat is one of the most dangerous things that you can have in your body. It's a setup for type 2 diabetes. It's a setup for many different kinds of cancer, for heart disease, and even dementia. There's a lot of research that links excess visceral fat with all these chronic diseases. So you want to avoid excess visceral fat. Now, how do you know if you have too much? Well, to measure it, you actually need to get a scan called a DEXA scan, or a dual energy X-ray absorptiometry scan, DEXA. And this scan measures the different types of tissue in your body, your bone, your muscle, your fat. Okay, and it tells you where that tissue is located, how much of it there is. So from research has already been done, we know that your body has normal, healthy fat, and of that fat, only 10% of it should be visceral fat. That's what you need to actually survive. But when you start exceeding that amount, all right, your belly is going to bulge. And when you see somebody with a beer gut, that's because a lot of that visceral fat inside the cavity of the belly has been growing, and it pushes out the belly from the inside out. All right, it's like pregnancy with a mound of fat. And if you can't get a DEXA scan, an easy way to assess whether you're gaining visceral fat is really check your belt size, your waist size, because when visceral fat grows, it actually expands your waist circumference. All right, that's the length around your waist and your belt size. You're going to need bigger pants. You're going to need bigger clothes, and your belt loop is going to actually get loosened up. All right, so if you need to expand your belt or you need bigger clothes, you're probably growing visceral fat. You don't even need to go on a scale to take a look at that. So, step number 1, if you want to lose visceral fat, do not overeat. Now, how do you do this? How do you avoid overeating? Well, I'm going to give you 3 practical tips. Tip number 1, take smaller portions when you're putting food onto your plate, right? It's up to you. You get the food, you're taking the spoon or fork on and putting on your plate. Keep about 2/3 of the plate empty. All right, lots of white space. Number 2, never feel like you have to clean your plate. You know that old saying about the Clean Plate Club, and there are starving people in every part of the world. Look, quit that club. That came during World War I and then World War Roman II as a way of actually trying to save food for the troops. Today, there's too much food, there's overabundance of food, and when you get it on your plate, okay, you shouldn't put it on yourself, but if somebody else puts it on for you, don't feel obliged to finish it. All right, there's a good chance if you do that, you're just going to go overeat. All right, and that will make it hard to lose visceral fat. And the third tip about not overeating is to follow the old Confucian rule that's called harachi bunmi. Harachi bunmi is a Japanese saying from the Confucian principle of stopping your food, stop eating when you're 80% full. All right, well, how do you do this? You say like I don't know how to do 80%. Well, if you eat slowly and you get in touch with your own body by eating slowly, your stomach will actually fill when it gets close to that 80% mark. It's going to be releasing a hormone called leptin. It's going to go to your brain and it's going to signal to your brain, hey, slow down, we are getting full. So this will allow you by slowing down eating and by being in touch with our body to know when your hunger has been satisfied, but you're not full. Right? Most of the time, we are kind of conditioned to eat until we're really full, and then we take it a few steps extra, and now we're uncomfortably full. We're stuffed. No, don't do that. Just eat slowly until your brain signals to you that you know we're actually done. That's about 80% full. Eating ultra-processed foods. This might seem like a no-brainer, right? Because ultra-processed foods contain added sugar, unhealthy fats, artificial preservatives, and colorings and flavorings, all the things that interfere with a healthy metabolism. All right, and you need a healthy metabolism to burn down visceral fat. So when you have ultra-processed foods, it damages your gut microbiome, which you need for your metabolism, and your gut microbiome also lowers inflammation. So now if you damage that gut microbiome, now your inflammatory levels are going to go up in your body. The other thing you should realize is that ultra-processed foods are really easy to overeat. Remember, I told you that's the first thing you don't want to do is overeat. And that's because many ultra-processed foods are engineered, designed to make you crave eating a lot of it. It's engineered for your brain to respond to the taste and the flavor, okay? To want to eat a lot of it. If you overindulge in those ultra-processed foods, not only you loading up on too many extra calories, but you're also loading up on all those other harmful additives that are actually going to interfere with your body's ability to burn visceral fat. There's a lot of clinical research around the benefits of coffee and burning down extra visceral fat. A study from the Harvard School of Public Health, for example, looked at men and women who are between the ages of 35 and 69. And these women are overweight and they had insulin resistance. But here's what these researchers did. They gave half of the group 4 cups of coffee made with robust beans, coffee beans, and they gave them 4 cups of coffee to drink every day for 6 months. And the other half of these people in the research study just got a placebo, all right, and at the end of the study, remember 4 cups of coffee every day for 6 months, coffee versus placebo, they measured their body composition. So they actually did put the people through a scanner after 6 months of coffee drinkers, 4 cups a day, shrank their body mass, meaning they shrank their weight by 6 pounds. They dropped 6 pounds. All right, just under 5 pounds, and they actually shrank their visceral fat just by drinking coffee. Now, what was interesting is that the placebo group, the group that didn't get the coffee, guess what? They were just allowed to eat. I mean, everybody just ate their normal food. The placebo group actually gained 4 pounds, so the coffee drinkers lost 6 pounds. The placebo group gained 4 pounds. Now, they separated even more widely. This is due to the chlorogenic acid in the coffee, the caffeine, and the caffeic acid. So drinking coffee is just one way that you can actually take to actually lose harmful visceral fat. There was a study done by a medical school in Iran. It's the Isfahan University of Medical Sciences. They do a lot of food as medicine research, and they looked at 70 women who are in a diabetes clinic with metabolic syndrome. These are women who had a little bit of extra weight, high blood pressure, high cholesterol, high blood sugar. That's a high big waist size. This is a high lots of visceral fat. This is the cardinal signs of metabolic syndrome. It again on your way to type 2 diabetes. And what they wanted to do with these women is to see what the effect of green tea is. So one group and these women were given 1 cup of green tea to drink 3 times a day. In other words, they got 3 cups of tea a day. That's the dose of tea times 8 weeks. 3 times a day times 8 weeks, right? And the other group, the other half only just got a placebo of warm water. And here's what they found when they actually measured the body weight, and they measured the waist circumference. So remember tube of the body, right? You got a lot of visceral fat. It's growing inside there. It's stretching out the tube, right? That's the beer gut, all right. When you shrink visceral fat, guess what? The circumference, your waist size contracts and your tube isn't stretched out as much, right? So, at the end of 8 weeks drinking tea 3 times a day, the researchers found that the tea drinkers lost 2 pounds and they had a smaller waist circumference, about almost an inch, 3/4 of an inch. It's like almost one belt hole smaller, and they measured exactly what was being lost, and it was their visceral fat, They lost visceral fat by drinking tea. Now they also measured other body parameters to see if drinking tea was also helpful for chronic diseases and physiological function, meaning normal body functions. And what they found is that the green tea drinkers also had lower blood pressure. Their systolic blood pressure, right? Blood pressure is like 120/70. High blood pressure is 140/90 or higher, the top number or the bottom number being much higher than normal, and it turns out that by drinking tea, the top number actually goes down. That protects you against stroke, because high blood pressure increases your risk dramatically of actually dying of a stroke. So lowering your systolic blood pressure really helpful. Weight loss tends to attract a lot of attention, which quickly becomes a populist idea, like people want to believe something that might not be true. So I was always skeptical about apple cider vinegar and weight loss. But then the research starts to come out, and this is where I, as a scientist, I have to be honest by saying, I can assume one thing, but if new data comes out that I look at, and I critically evaluate, and the data shows that something is true or untrue, I've got to go with the data. So with apple cider vinegar, I was astounded to see that our researchers in Japan had been studying a dose-dependent effect of apple cider vinegar on metabolism, and that's weight loss. That's actually reduction in body composition when it comes to visceral fat. That's lowering of inflammatory markers in the blood. The real research that one does in food as medicine, not the woo-woo stuff. And what I saw was really quite remarkable. First, in one of these research studies, they gave people, what they called low dose, which is 1 tablespoon of apple cider vinegar versus high dose, which is 3 tablespoons of apple cider vinegar. So, if you imagine in your kitchen taking out a bottle of apple cider vinegar and pouring 3 tablespoons into a small cup, all right, that 3 tablespoons is pretty easy to drink if you had to. It's a quick shot. They studied this daily over the course of a month. And what they found indeed is that people who had any apple cider vinegar, compared to a placebo, which is drinking water, that any apple cider vinegar would actually shrink waist circumference, which is the size of your waist. And the waist circumference reflects how much fat is in the tube of your body, right? So, and that's visceral fat inside there. So, over the course of a month, apple cider vinegar drinkers had a shrinking of their waist circumference. So, and they had less body fat, and their inflammatory markers also went down, and they actually lost, weight when you looked on a scale. That's pretty amazing to me that you can do a study to show that this works. Now, couple of fine points. The people who had the higher dose, 3 tablespoons of apple cider vinegar, lost more weight, lost more body fat than the ones who had 1 tablespoon. And that's a dose response, which is a good sign that there's something real biologically going on. All right, usually if it's sort of you can have different kinds of dose responses. This one was pretty convincing that something was working. If a little bit is good, a little bit more can actually have even a greater effect and loss more fat. And the fact that the type of fat that was lost was visceral fat. That is the harmful inflammatory fat that we really want to deal with, especially by the way in Southeast Asians. That's really the kind of the apple shape that people can become as they get older. And the apple is really where the waist size expands, because you wind up actually growing more visceral fat. Visceral means guts, and visceral fat is a fat that kind of naturally grows around the guts. But when it builds up, you expand your waist size, so you want to kind of reverse that. Apple cider vinegar actually works. Now, couple of things about it. When you break it down into what is actually happening, because I always ask, does something work in people? Doesn't work in people, like we've cured cancer in mice all for years. Doesn't mean that it's going to work in people. But something that works in people now, it's worth going back into exploring what's the mechanism of action, like an inquiring scientist always wants to know. So guess what? It's not the apples and apple cider vinegar. It's not the apple source. It's the vinegar. It's the acetic acid. All vinegar is made with acetic acid. In fact, acetic acid is a definition of vinegar, which is another name for vinegar. The chemists call acetic acid, the chefs call it vinegar. All right, and vinegar actually works by preventing fat cells in our body. These fat cells are called adipocytes. Adipose fat site cell of vinegar acetic acid prevents fat cells from expanding. All right, and it also impedes your body's own ability to make new fat cells. So we all are born with fat cells. They expand. It's our fuel tank. If you are still eating and you're building more fat, your body can make new fat cells with stem cells. So now you actually create more fuel tanks, and you can grow your fat mass. Acetic acid prevents the first fat masses from blowing up like expanding, and it prevents the new ones from growing as well. We think that that's really one of the primary mechanisms of action acetic acid or vinegar. What does that mean? That means that apple cider vinegar is good. That's been shown in clinical studies, but it means that other vinegars are also good. White vinegar, red wine vinegar. There's all kinds of vinegar you can actually make with a variety of different fruits and vegetables, frankly, that can all be fermented to create that acetic acid. If you take a look at countries in Asia, they have black vinegar, fermented vinegars. There's a whole, go into any store that carries a variety of vinegars, and you will be blown away by the diversity of how you create vinegar. My health tip, anybody who is interested in exploring this for themselves, is if you are whatever the vinegar is, please pick up the bottle and read the label for the ingredients, because you want to make sure that it really is indeed true apple cider vinegar or red wine vinegar, and it doesn't have other ingredients added to it, because many times, intentioned companies will want to doctor up or put additives into a vinegar in order to make it more appealing. Great example is salad dressing. Salad dressing is made with vinegar and oil, but in a salad dressing, they'll put all kinds of things in there to make that product seem more appealing. And those additives can actually be detrimental to your health and detrimental to your metabolism. Hey, if you like that video, then you're going to love this one. Check it out.